Hello everyone, this is Professor Draud. I wanted to bring you this last video for this section, and this is the last objective where we ask you to describe or identify the causes and the characteristics of these joint disorders: bursitis, osteoarthritis, a strain, a slipped or a herniated disc, tendinitis, gout, sprain, and rheumatoid arthritis. So let's begin today by talking a little bit about a sprain. A sprain is an injury to a ligament. This can be caused by repetitive motion or an overextension. And once again, a ligament is what connects bone to bone. A strain is an injury to a muscle or a tendon. And again, this can be caused by repetitive motion or overextension. Remember that tendons connect muscle to bone. The next is gout or gouty arthritis. This occurs when nucleic acids are metabolized. They produce something called uric acid. And uric acid is normally excreted in the urine. Now, skeletal muscles are highly multinucleated, and they have a lot of DNA and RNA. So, of course, a lot of uric acid is produced in skeletal muscle. If the blood uric acid rises due to either decreased excretion in the urine or increased production, it might begin to form these needle-shaped crystals in the soft tissues of joints. This results in inflammation and painful arthritis or inflammation. Tendinitis are, you can spell it tendinitis or tendonitis. It is an inflammation or irritation of a tendon, a thick cord that attaches bone to muscle. Tendinitis is often caused by repetitive, minor impact on the affected area or from a sudden, more serious overexertion. Bursitis is a swelling or an irritation of the bursa. Bursitis is often a result of overuse. It can be caused by a change in activity level, such as training for a marathon, or by being overweight. Bursitis can also be caused by trauma, rheumatoid arthritis, gout, or infections. Sometimes the cause just simply can't be found. Bursitis commonly occurs in the shoulder, the knee, the elbow, and the hip. Other areas that may be affected include the Achilles tendon and the foot. A herniated or slipped disc occurs when all or part of the nucleus pulposus is forced through a weakened part of the annulus fibrosus. This places pressure on the nearby nerves. The causes: too much weight or pressure being applied to the disc, some sort of accident, some heavy lifting where you're lifting with your back and not your legs, or from too much twisting. Arthritis itself describes about 100 different types of inflammatory or degenerative joint diseases. Osteoarthritis is the most common, and it's normal joint use, what happens is normal joint use prompts the release of cartilage damaging enzymes. If cartilage destruction exceeds cartilage replacement, what we get left with is rough, cracked, eroded cartilages. Eventually, bone tissue thickens and it forms spurs that can actually restrict movement altogether. And this is most common in the spine, the fingers, the knuckles, the knees, and the hips. The last slide here is rheumatoid arthritis, which is a chronic inflammatory disorder. This is marked by sudden flare-ups, and this is an autoimmune disease. The body creates antibodies which attack the joint surfaces. That's why it's an autoimmune disease. The synovial membrane gets inflamed and eventually thickens into a pannus, which is an abnormal tissue that clings to articular cartilage. And the pannus erodes the cartilage and eventually scar tissue forms and connects the two bone ends. This scar tissue can later ossify, which actually fuses the bones together. And that's known as ankylosis. It's obviously extremely painful. So this is just a quick video to talk about some of the diseases that we talked about in this last objective.